So, what are some of the signs and symptoms of hydrocephalus? Well, like earlier mentioned, remember in infants or babies, their bones of the skull are not fully fused, so there will be an evident increase in the head size. There will be vomiting. The babies may be easily irritable. They might be having seizures or convulsions, prominent scalp veins. Sometimes they might also have the downward deviation of the eyes, also known as the sunset eyes. In children and adolescents whose fontanelles have closed, whose heads, skulls have fully fused, these could be the signs and symptoms that you're going to observe in them. They are going to present with nausea and vomiting, blurred or double vision. They'll have some balance and gait abnormalities. Sometimes this child just starts to lose their balance even as they are walking. They were fine before, but they start losing their balance as they are walking, and you don't understand why. It is very common to, when you start spinning, yes, after spinning for some time, you might become dizzy. But the dizziness in these children is unexplained. They might just start having balance and gait abnormalities. They might also be having some swallowing problems, poor appetite. They might be having some urinary incontinence, meaning they'll be failing to control their urine. There might also be some inability to concentrate and just some changes in personality. In adults, what could be some signs that this person is having hydrocephalus? Also a buildup of fluid in the brain, because remember, in children there's that opening, but in adults it's fused. So if there's any increase in the water, it is squeezed, it is just contained within the brain, it has got nowhere to escape. So how then do you know that this could be hydrocephalus in an adult whose head is not growing bigger? So these could be some signs that you're going to notice in an adult. This could include a headache, nausea and vomiting. They'll also present with difficulty in walking or gait disturbances. They might have loss of balance or coordination. They might have mild dementia or memory loss, as well as impaired vision. They might also have urinary incontinence. So, how do you diagnose this could be hydrocephalus? Well, several tests could be performed to ascertain whether or not it is hydrocephalus, and some of these tests include a lumbar puncture, an intracranial pressure monitoring, as well as a CT scan. These could be some of the few tests that could be performed just to ascertain whether it could be hydrocephalus or not. Is there any treatment or management of hydrocephalus? Yes, there is. Hydrocephalus is mainly managed surgically. A tube is passed from the brain to drain the extra fluid from the brain into the stomach so that that water should be absorbed by the entire body. And how long can this child have this tube in the body or within the body? This tube can actually stay in the body for quite some years, but it's very important for the parents or caregivers to always be observing their child, because sometimes the tube can be blocked. And when it is blocked, it stops draining the water from the head to the stomach. The head continues to bulge and bulge and bulge, which could even lead to further complications, and in worst case scenarios could lead into death. So it's very important that when you start observing something unusual, you always rush back to the healthcare practitioner, tell them about your experience at home, and they will guide you, they will assess, and they will treat the child better. So this tube also, I must mention, is that it can constantly be changed. As the child is growing taller, the tube, as you can imagine, will start getting shorter, meaning it will need to be replaced by a longer tube later on in life. So for example, if they have a tube now at birth, they might have to change it. If it's not blocked, they might have to change it maybe after 3 years or so, maybe after 4 or 6 years. It has to constantly be changing until they become an adult and stops growing taller, and just make sure that you keep on observing that the tube is not getting blocked. Are there any complications of having hydrocephalus? Yes. Hydrocephalus, if left untreated, can actually cause a lot of more serious complications. Complications such as brain damage because there'll be too much pressure on the brain, seizures, paralysis, because the brain, like we know, is the boss of the body, is the biggest machine of the body. So if the brain is not functioning well, meaning the entire body would just not function properly. And I also advise that if diagnosed with hydrocephalus, it is very important to pass through a physiotherapy department because these clients might present with some neurological deficits, which could also be managed through the physiotherapy department. So about hydrocephalus, we're going to end here today. Thanks for watching. If you have any comments, questions, or contributions, please pass them down in the comment section and I'll be very excited to read them. Thank you so much. Bye-bye.